Welcome to another Topic Tuesday. This is Dr. Mike McCall from Source Health Center. I want to talk about plantar fasciitis. I get a lot of patients ask me, do I do work on plantar fasciitis? And of course I do. I work on everything. I mean, come on. So, I've had lots of success with plantar fasciitis, and this is why. The most overlooked muscle I see in plantar fasciitis cases is a special muscle called the posterior tibialis. You can Google that. It's a beautiful muscle. It runs deep to your calf, and it has like 9 attachments to the bones in the foot. Its main focus is to take your arch and lift it. And a lot of times the little plantar muscles are there just to kind of assist it, but once the big boy's out of town, the little guys are straining too much, and that's one of the biggest things to see. Now, another thing about plantar fasciitis that not many people know, that's why we have Topic Tuesdays, by the way, is it's sensitive to people who do sugar all the time. I'm not lying to you, this is true. If you have plantar fasciitis and you're a runner, you may want to start cutting down your carbs and adding more protein. Just saying, it's worth a try. It won't kill you. It's non-toxic, non-invasive, and inexpensive. It's worth a try. So many times you got to make sure that the inflammation in your body is better, because a lot of times that can happen. Now, persistent plantar fasciitis, when you've done a reasonable care, you've done physical therapy or chiropractic or acupuncture, and you're still in the hole, can't get better, you want to look at your diet. You also want to look at, are you drinking enough water? And you might want to look into a food allergy. A lot of times when you have a chronic musculoskeletal problem and you've had reasonable care, which I just mentioned, you may want to look into, you might have a food allergy. I wouldn't go to what's that kind of doctor called? An allergist. I would actually do some more of the finger prick ones and send them in, because they're going to be looking at different antibodies that will not, that will show up that can create musculoskeletal pain. But if you want to save money on labs, you would first start taking wheat out of your diet 100% for 2 weeks. Then reintroduce it and see what happens. The next one I would try would be milk or dairy. The next one I would be doing is soy. Then the next one I'd be doing is corn. The next one I'd be doing is sugar. You can try to eliminate all those and see how they work. Just remember where you heard it, folks. Source Health Center, Dr. Mike McCall. We'll see you next Tuesday.